Hello and good afternoon once again. This is Dr. Alalade here on ATG, and we are simultaneously broadcasting on Instagram and recording on YouTube and also on Facebook here. First of all, I want to wish you good afternoon, first of all, and I hope you're having a wonderful time today and for the week as well. This afternoon, I'll be talking about HSG. And I'll explain the meaning of HSG, the purpose of HSG, so that you understand why we doctors order for HSG as part of your infertility investigations, and most importantly, what HSG is designed to show. Some people assume HSG shows so many things, but there's a specific thing that HSG is supposed to show, and other tests will be needed to find other things. Winifred Ogechukwu Akwarandu, happy birthday to you. How are you? I think I already sent you happy birthday directly on your messenger. Thank you so much. I wish you many happy returns of the day and long life and prosperity. EPPOA. And if you're watching here, and if you know Winifred Ogechukwu Akwarandu, please wish her happy birthday. So tonight I'll be talking about HSG. I'm hoping my audio is good. So let me quickly check my audio here. Let's check this audio thing. Oh, good. So I think my audio is good. So if you can hear me, let me know before I start talking. And if you can see me clearly on Instagram, let me know as well. Instagram is a bit further away from me here, but I'm sure people on Instagram can see me loud and clear from that side of things. So I'll be using this blackboard today to explain to you and to demonstrate what HSG is and what it's supposed to show. Because I get so many questions from our wonderful, beautiful ladies. They've gone for infertility tests and they are wondering that my HSG did not show anything in my womb, blah, 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 blah. So I said that, okay, today I'll take my time out and do this special teaching to explain what HSG is and what it's about. So follow me and let's crack on. I'm getting ready for work as well, so I won't take too much of your time, okay? As I always do. All right, so that is your womb here. Let me see if everybody can see me clear. Good. So that is your womb, okay? That is just the way the womb looks like. Okay? And this space here is your vagina. Okay? Inside here, on this side and on that side, is your tube coming in. Okay? And you have your ovaries here attached to a ligament to your body. The ovaries is there attached to a ligament to your body. And they have the tube opening there. Okay? Good. I hope this is making some sense. So that is your tube. Okay. All right. So that is exactly the way your womb is. This cavity here is where your baby lives in if you get pregnant. Okay? That is where your baby lives in if you get pregnant. And after, when you get to full term, baby will come out, you go into labor and the womb will open. Now, the HSG we do, okay, it's called HSG. And the full meaning of, and I know people watching me on live show now, you'll be seeing everything I'm writing in reverse. By the time I put it back on the YouTube channel, it will be exactly the way it is, live and direct. So make sure you watch the YouTube version of it later, tomorrow, okay? You see everything I'm explaining here in the correct picture format, okay? HSG means estero. Salpingo. So it's 3 words in one. Estero, salpingo, guam. HSG. Estero in Latin means womb. Hysteria, to have pain. Because womb is associated with pain. So hysteria Hysteria in Latin means excitement or pain. Okay, so they've called the womb hystero, uterus. From that hystero, we took the word English from Latin, English, uterus. Hystero, the same word as hysterical. Okay, it means to be in pain. The womb causes pain during period, sometimes, and even during labor, because the womb is a bag of muscle, it contracts. So salpingo is salpinges. It means tube, right, tube, or left. The salpinges in Latin is tubes, fallopian tubes. Anything you hear salpinges, okay, in Latin is just tube. It can be any tube, but in this case is fallopian tube. And gram in Latin means study, a kind of a study. So we are studying, or we are weighing, or we are evaluating the womb, the tubes, and it's a study. That's all. So doing HSG, what we are doing, okay, is to see primarily if the tubes are open or not. Every other thing will come later, but the primary reason why we do HSG, okay, is to check if there's blockage in the tubes or the tubes are open. Again, the primary purpose of HSG, hysterosalpingogram, is to know if there's blockage in the tubes or not. Now, HSG is part of the investigations we do for infertility. And when I say infertility is basically to say, why is this couple, why is this woman, why is this man not able to get pregnant? And if you're watching me over the weekend, I explained 3 major causes of infertility. And I said number 1, okay, is ovulation failure. Number 2 is blockage in the tubes. And number 3 is issues with the semen. Those are the 3 major causes of infertility. There are other things too. But if a woman is not able to get pregnant, if a man is not able to get pregnant, the main cause of infertility, among those couple is the woman ovulating, number 1. Is there any blockage in the tubes, number 2? And is the semen okay? Today I'll be focusing more on the tubes, okay, because I've got so many questions about the tubes. Now, I'll use this red pen to explain. During HSG, we push in a dye. Now, first of all, HSG is to check if the tubes are open or closed. HSG is not designed to check for fibroid in your womb. HSG is not designed to open blocked tubes. HSG is not designed to open blocked tubes. HSG is not designed to locate fibroid in your womb. HSG may well locate fibroid in your womb or give a suggestion that there could be fibroid, or there could be what we call filling defects in your womb that could suggest fibroid. HSG could suggest that, oh, this woman may have adhesions or scar tissue in the womb. Those will be suggested, okay, as suggested findings or possibilities in your HSG. But HSG is not designed primarily to diagnose fibroid. HSG is not designed to diagnose ovarian cyst. HSG is not designed to diagnose scar tissue or adhesions or Asherman syndrome. HSG is not designed primarily to unblock tubes. Okay, please get that right tonight, and please pay attention to me as I continue. During HSG, okay, we push in a dye. Okay, it's we call it contrast dye. DEY. Okay, we push in the dye, okay, from your vagina here, and that dye will go into your womb cavity and will spill into your tubes outside here, on this side and on this side, if the tubes are not blocked. Don't forget that all over here is your bowel, in your tummy, your bowel everywhere, your bowel is everywhere here, okay? So if there's no blockage in the tubes, the dye will flow from vagina into your womb cavity, and it will spill into your tubes on both sides, and it will pour out into your tummy. And then we take X-ray. We call it fluoroscopy X-ray. HSG is an X-ray test, okay? But if you know x-rays, x-rays only pick up bones. X-rays cannot pick up soft tissues like womb or anything like bowels. X-ray will not show them clearly. Okay? X-rays will only show stuff that are very thick like bone. But to make sure that we can see your womb or your tubes, we have to put a contrast that will enhance the image. So when you're watching TV and you're pressing contrast on your TV control, you're trying to enhance the image. The same thing too with the dye. The contrast dye is a dye that will help us to enhance the picture, to enhance the visualization of the tubes and the womb. So we put a tiny cannula into your vagina. Okay? Sometimes when we try to put this cannula, because your vagina, through your vagina into your cervix. Now, this vagina, that's where your husband penis stays. But this hole, that black tiny spot I put there, right, is your cervix. That's what opens to allow baby to come down during labor. You can see this black stuff here. Let me do it again here so you can see what I'm saying. So you can see this is your cervix. That hole. You see that hole there is your cervix. All right? That's the hole that we push in the dye through. We put a tiny cannula. That cannula is very tiny, like the ink of a pen. You know that tiny part of your pen that contains ink for biro? That's the way the cannula is, very tiny. We put it into your cervix. Sometimes when we try to put this cannula into some people's cervixes, it's not possible because cervix is very closed. Especially if they've never had children before, or if they've had treatment like DNC, or they've had infection, or they've had DNC or treatment to maybe some bad cells on the cervix could be tightly closed. But in most cases, the cervix is open, especially if we do your HSG shortly after your period ends. So if you're going for HSG, first of all, we tell you to abstain from sex at least 2 to 3 weeks before the HSG. The idea is that we don't want to push a dye into your tummy, into your womb when there's pregnancy there, possibly. So if you go for HSG, they tell you to abstain from sex at least 2 to 3 weeks before coming for the HSG. Okay? We also tell you to do swabs to check for infections like chlamydia, gonorrhea, because if an infection is hiding in your vagina and we do HSG, we'll just push the infection inside, and the infection will go into your tubes and go and damage the tubes. So we want to do swabs for you to check that you don't have infection before you go for the HSG. So you do swabs a week or two before you go for HSG. We get a result, and if the result is all clear, we proceed. If it's not conclusive, we give you antibiotics as a precaution. Okay? And the reason why we do HSG shortly after your period is that in most cases, shortly after your period, we know that definitely you're not pregnant. Definitely we know that your cervix is slightly open, and it's much, much easier for us to get access into your cervix. So if, as soon as your lab will tell you, if you want to come for HSG, they will say, as soon as you see your period, call us. So once you see your period, you call them, okay? They will not give you a date to come for HSG around day 5 or day 6, before day 9 or day 10. So that as soon as your period stops around day 4 or 5, you go for HSG anytime between day 5, 6, 7, 8, 9, 10, before you ovulate in that cycle. So we want to get HSG done usually from around day 5 or day 6, before day 9 or 10 of your cycle, so that we know, for example, because if you're just having a period, you're unlikely to be pregnant. You've abstained from sex 2 weeks before the HSG, you're not getting pregnant. And when you come for HSG, the first thing we do on that day is to do pregnancy test. Okay, nobody wants to push in the dye, contrast dye, into your tummy when there's a pregnancy there. Okay, now that's all being said, so we put in this cannula, very, 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 very tiny. Let's say this is the cannula. The cannula will stay in your vagina here, okay? And we introduce the dye. The dye will go into your womb cavity. As it's there, it will fill the womb, and then it will now start moving into your tubes on this side and into the tubes on that side. And once it's gone through the tubes, if there's no blockage in the tubes, the dye will flow out on this side and flow out on that side. And we now take x-rays, pam, 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 about 3 or 4 shots, and we see the dye coming out as a white string. That means the tubes, we now say the tubes are patent. Patency means not blocked. We tell you your tubes are patent, there's no blockage, all good. Or we tell you there's no spillage on both sides. That means that there's blockage. Or we say there's a spillage on one side and there's no spillage on the other side. That means there's blockage on one side and there's no blockage on the other side. Sometimes through doing HSG, your tubes go into shock. You know when you touch earthworms, okay, just after rain falls in Africa, you see earthworms moving on the floor. You touch them, bam, they just stop moving. They go into shock, like a spasm. The same thing too, when the dye goes into the womb, some tubes will go into shock, state of shock, and they'll stop like that, and they'll contract. And the dye will not be able to go in through and through. So sometimes too, in that sort of situation, we can't make any conclusion. We now repeat the HSG or do a different test, which I will explain later. So number one. Okay, another reason, okay, we doing HSG, some people will be in pain and they're not able to tolerate the pain. Then we now abort or stop the test and say because the woman is in pain, she wants the test to be stopped and we have to stop it. That's why I tell people before going for HSG, always take pain medications. I always say that all the time. I say take paracetamol. You can take ibuprofen if you don't have ulcer or if you don't have asthma. If you don't have asthma or ulcer, you can take ibuprofen or you can take your diclofenac as well. They'll help with pain before going for HSG. You can also use Buscopan. At least take all these things, paracetamol, ibuprofen, and Buscopan, maybe an hour or two before going for HSG. It makes HSG comfortable, doable, and tolerable for you. HSG, while the dye is going in, it might show some, the dye will go into your womb cavity, it will fill the womb. So if there's a fibroid there like that, on the x-ray, we'll see a possible, what we call filling defect. The dye will not fill this part of the womb, and we can suspect that there's possibly a fibroid there. Sometimes there could be scar tissue adhesions, what we call Asherman syndrome, in your womb cavity, and the dye will not be able to go through. That can happen too. In such cases too, we can see that, or we see signs that suggest that too during your HSG. But HSG is not designed to show a cyst in your womb cavity. It's not primarily designed to show fibroid in your womb. It's not primarily designed to unblock tubes. I've seen people that they had blocked tubes, and shortly after the HSG, they had sex and they got pregnant, and they've been trying for years. But shortly after the HSG, sometimes I've seen cases where as the dye is going through with pressure, it will unblock any blockage in the tubes. But HSG is not primarily designed to unblock tubes. If your tubes become unblocked during HSG, good for you. That's why I tell people all the time, if we do HSG for you and we are able to see that both tubes are not blocked during the HSG, I always tell people to start having sex regularly from about 3 to 4 days after HSG. Now, if you have an infection that is not treated or that is hiding in your vagina that is not picked and we do HSG, the infection could move into your womb cavity and go and cause PID. Any infection that moves into your vagina and ascend above and moves into your tube, into your tummy, can cause PID. Very rarely, but it can happen. That is why if you have an infection, or if you're not abstaining from sex, or you're in an unstable relationship, you can be at increased risk of having PID. That is why we do swabs for you to check for infection in your vagina before you go for HSG. That is important and paramount. Also, doing HSG, okay, we usually get our answer. But in some very rare situations, after HSG, or if we have inconclusive results on HSG, or you're in pain and we can't conclude the HSG, we can do what we call a test called laparoscopy and dye test. It's an operation. This operation is also to check if the tubes are open or closed. We have to put you to sleep for that under general anesthesia. We put a camera through your belly button and we blow your tummy up with some air, like we are vulcanizing a tire, so we can see everything in your tummy, your bowels, your womb, everything moving. While we are there looking, somebody, one of the doctors, usually a junior doctor, will push in a blue dye, the same way we do HSG. We'll push in a blue dye into your vagina and we will see the blue dye come out of your tubes on both sides. if there's no blockage. While we are looking from above into your tummy, we see the dye come out like that, and we'll see all your organs become blue. That is laparoscopy and dye test, and your body will reabsorb the blue dye after a while without any wahala. Okay, the dye is inert. We call it inert. Don't worry, it's science. Inert, I-N-E-R-T. It's absorbed by the body, and then we can see the tubes are open and closed. And while we are there doing laparoscopy, if we see a cyst there and the ovary like that, we can treat them at the same time. Another test which is not very available in Nigeria is hysterosonogram. It's also used to check if the tubes are open or closed. We call it hysterosonogram. Basically, it's a kind of an ultrasound scan where we use some fluid, saline. We call it saline hysterosonogram. Basically, we use that water to flush the womb, and we see the tubes open and close while we're doing the scan. It can be done as well. In fact, with some good hands, it can be very reliable. But it's not very available in most places, okay? Mary Ades, you're asking what is HSG. Don't worry. Just watch the video over again. I've explained everything, and I even wrote the meaning of HSG above here. HSG, I said it means hysterosonogram, and it's designed to check if there's blockage in your tubes to assess reasons for infertility in any patient. Okay, now let's take some few questions before I pop up, because I need to get ready for my business. So let's take some questions, okay, and then we will call it an afternoon. So let's take some questions here. I can see people joining in. Ade Damalami, wonderful lady. She's my friend on Facebook. Cecilia Sage Ekanem, Mary Alex, Gloria Wanko Konji, one of our moderators here. Olufunke Adebayoni, Gloria, thank you so much. I can see your fingerprint. Wadong Mavis, Vivian Dico Briggs, thank you, one of our sweet moderators here as well. Oba Sweetie, I can see you. I can see Vivian. I can see Omalara Bokini. I can see Gloria Okonji. She's giving the address of our laboratory. So Gloria is giving and putting up on the screen the laboratory address. The laboratory address. So if you have any issue with infertility, you want to do infertility tests, you can walk into ATG Laboratories tomorrow and get all your tests done. There's a question here on Instagram. Somebody is saying that, can HSG detect pregnancy? HSG is not to detect pregnancy. And no doctor should push in the dye into your tummy if there's pregnancy there. If you're pregnant, HSG should not be done. To ensure you're not pregnant before HSG, we do test of pregnancy, reliable test in the laboratory. We also tell you to abstain from sex 2 to 3 weeks before the HSG. And we always tell you to come for HSG a day or two after your period stops, so that you're not pregnant. And we tell you to abstain, so that nobody in their right senses should go and put a dye when there's a baby there. So HSG is not designed to check baby, okay? And HSG should not be done if you are presumed to be pregnant, okay? So that should take care of that. Can one menstruate without ovulating? Yes. If somebody has PCOS, they can menstruate without ovulating. And how do we know you have PCOS? Go and do laboratory tests. HSG, FSH, LH hormone, and ultrasound scan as well. That will help us to know if you have polycystic ovarian syndrome, which can make you not to ovulate. Okay? Thank you guys for being here. I'll take 1 or 2 questions before I go. At present, we don't do the HSG at ATG Laboratories, yes, but we are putting facilities in place so that we can do HSG in our laboratory at ATG. We're trying to get some space. Once we get approved with space available, we'll get HSG done. But any of your other infertility tests, including ultrasound scan, you can get them done at the ATG Laboratories today. Just call the number that Gloria has put up on the screen tomorrow morning, okay, and walk into the laboratories and do all your tests. You can do your tests for your husband, semen analysis, semen microbiology. You can do semen count, like I said. You can do all your hormone profile. You can do your kidney function. If you have anybody at home that is old, you can do their kidney function, their liver function, check your prolactin, the thyroid gland, your thyroid function test. You can check your pregnancy test, check your HIV, hepatitis B, hepatitis C, check your H. pylori to know if you have ulcer, if you're having pain, and you don't know what's causing your pain. You can check your gallbladder on scan to check for stones, for kidney stones. You can check your liver, your kidney. You can check your calcium, and you can check anything on scan at that laboratory. And in fact, we are coming up within the next few weeks with our IVF facility that will take care of pregnancy and get you pregnant at your own comfort. Thank you everyone for listening. Okay, so there's a question here on Instagram. I have done HSG. They said they unblocked only 1 tube. Can I be pregnant? As far as you have one good tube, you can get pregnant. Okay? If, for example, now this tube is bad now, okay, and you ovulate from this ovary, this good tube can pick up the egg. Yes, that's nature for you. If you ovulate from here, this tube can pick it up. If you ovulate from here, this good tube can pick it up. That is if this tube is gone. So nature has its own control system that is God given, and that is where it works. So, but if you've lost your tube, your chances of pregnancy will drop by 30% to around 70%. Okay, if you've lost a tube, chances of pregnancy drops from 100 to 70, but you can still get pregnant. Okay. Thank you guys for being here today. I appreciate you. I hope to see you soon tomorrow as well. God bless you. Have a wonderful week as well. And don't forget to register for the seminar coming up this weekend, Saturday 24th on IVF. It's going to be amazing. People are already sponsoring people. A lady just sponsored 5 people about 30 minutes ago to attend the seminar. And we're going to give those spaces to 5 people that deserve it. But if you're also blessed, you want to sponsor other people to attend the seminar, please do so today, now, and get people into the move. By people coming for the seminar, we're going to ensure that they get discount to get the IVF done if they need it. So if you're blessed, you want to sponsor people, do that today and let your blessings of God flow through you. Let the blessings of God flow through you amicably, perfectly, and in a wonderful way. And we are also trying to ensure that we give spaces to people as well that need. So support people if you can. But if you're all not yet registered for the seminar, get subscribed now for the seminar coming up this weekend on IVF. It's going to be amazing. I'm going to go through full details, one-on-one, on how you can make IVF work for you successfully. Thank you very much. See you soon. God bless. Thank you, Christina. Thank you guys for being here. I love you all. See you soon. Bye-bye. Swaps.